And we're back with Hippocrates Diet and Health Program by Wigmore. Okay, so we just talked about the general concept of why it's important to go on this diet. And now we're going to go even deeper into chapter 2, Let Food Be Your Medicine. Let's go right in, baby. Okay, let food be your medicine. The food you eat can be either the safest and most powerful form of medicine or the slowest form of poison. Of course, food as medicine usually affects the body much more slowly than modern drugs, but in the end, it can be safer and more thorough. It works by removing the causes of the illness, whereas most drugs merely relieve the outer symptoms. We know this, right? We've been hearing this more now more than ever, that we want to get to the root of the cause rather than just to alleviate the symptoms, which is what most modern Western medicine does. Let food be your medicine and medicine be your food, said Hippocrates in 460 to 377 BC. Okay, so Hippocrates was a physician back in 460 BC that knew that food was medicine. And this is a really important concept, and that's why it's called the Hippocrates diet. And his wisdom is truly among us. So I have a lot of books personally. We're talking Rebecca here. I come from a Jewish perspective, so I follow a rabbi called Maimonides, who was also studying as a physician, studying from Hippocrates as a physician, and he has his own philosophies, which are very similar to this, back in such a long time ago that it's really despicable to know that it took so long for us to come back to it. But we're here now, and we're here with open ears and open heart. So let's listen, and let's listen clearly. So let food be your medicine and medicine be your food, said Hippocrates, who clinically treated thousands of patients and kept detailed records of many of his cases. The records reveal a mixture of success and failure with the natural approach he preferred. In some cases, he resorted to surgery and non-toxic herb drugs, but only in emergencies. In all cases, he attempted to understand the patient's life and psychology before prescribing any course of treatment. Since the days of ancient Greece, there have been hundreds of Western drugless healers who have had equal or better success than Hippocrates. And in the Orient, the famed Yellow Emperor and many other physicians employed natural therapies for thousands of years, dating back to at least 5,000 years before the time of Christ. Chemotherapy and surgical techniques, modern man's replacement for natural treatment, are still in their embryonic stages. It is a relatively new idea to use surgery to treat common complaints, and in some cases, even to prevent problems. Having been used extensively for only the past 50 years, these techniques have had a variable success rate. Despite huge advances in the uses of surgery and chemotherapy over the past 25 years, life expectancy in the US has increased less than 4 years on the average. Less than 4, okay, so he's saying life expectancy in the US has only increased less than 4 years on the average, while the death rate due to cancer, heart disease, and other degenerative conditions has risen sharply. That's major. Many synthetic drugs have been banned by the US Food and Drug Administration, the FDA, due to their numerous side effects. Thalidomide is merely the most notorious of dozens of these. On the other hand, penicillin, digitalis, and aspirin are examples of safe and effective drugs derived from natural sources. However, because even these drugs are more concentrated than the active ingredients found in foods or herbs, they have a faster action, are easier to abuse, and may produce side effects. One of the side effects that drugs are largely responsible for is psychological, our apathetic attitude towards self-responsibility in matters of personal health. We are no longer responsible for our illnesses. Microbes, germs, the weather, communism, or the wrath of unfair God is blamed for the imbalance, and a miracle cure in the form of a pill is recommended as the cure. Rarely does the physician ask the patient to look at his entire lifestyle in order to find the source of stress, dietary or otherwise, that has created the problem. We identify our bodies with simple, man-made machines that can only be fixed by an expert, qualified mechanic. Like our broken cars, our broken bodies are brought to the garbage, the hospital. for repairs. But is the body a lifeless machine that breaks down with use? Do we really need an outsider's intervention to correct the common cold, a headache, or even more serious problems? The body is a self-healer. We all accept the simple fact that when we cut a finger or scrape a knee, our body begins repairs of the injury immediately. When the proper precautions are taken, there is no trace of any problem a few days later. Can we extend this seemingly simple, but in reality extremely complex bodily response to other more serious problems such as obesity, heart disease, diabetes, or cancer? The fact that some people get cancer and fail to heal themselves by diet alone does not invalidate self-healing or natural therapy, but only the diet they are using. Obviously, the same diet that causes cancer cannot be expected to cure it too. To prevent or reverse cancer with food, you would require a diet which contained many anti-cancer properties and high-quality nourishment. Yet despite the thousands of case histories and mounting medical evidence to the contrary, many Americans have little faith in their ability to heal themselves when ill. You may be doubting it yourself as you read these words, but why does the human body, the very zenith of evolutionary development of Earth, fail to heal itself any more effectively than does the rabbit or a duck? Can you name a single species of creature outside our own whom, when hurt or ill, does not heal itself? We must remember that an animal's powerful instincts lead him to the cure. Civilization has all but snuffed out the little intuition or instinct we once had. We have become desensitized, lying, helpless, and hopeless. We submit our weakened bodies to specialists for care. Your body can and will heal itself if given the proper nourishment, rest, and exercise. Every second you are alive, thousands of messages are being sent head to toe in an effort to maintain and restore balance in your body. If you are smoking a pack of cigarettes every day, your body may react by secreting excess mucus in the lungs to protect them and you from the vile smoke. Unfortunately, this emergency measure reduces vital lung capacity and slowly undermines the body's oxygen transport system so that the smoker slowly dies by degrees. According to a report by Dr. Lepage and Midler, published in Cancer Research, a high-protein diet can cause blood and cells to become too richly supplied with protein. When this occurs, the lymphatic system attempts to remove the excess. However, if the burden becomes too great for the lymph to handle, protein traps or tumors are created, which are sealed off in order to protect the rest of the body from their contents. As Nobel Prize winner Dr. Otto Warburg showed, when oxygen supply is decreased by as little as 30%, these trapped cells can become malignant cancer cells. Warburg found that unlike normal healthy cells, malignant cancer cells don't require oxygen to reproduce. In a sense, the cancerous cells consume waste, saving the body from poisoning by excess protein. But the body is also threatened by uncontrolled terminal cancer. For centuries, drugless healers have depended entirely on the body's ability to heal itself. By observing animals in nature, there are often miraculous recoveries from accidents, poisoning, or starvation. These practitioners have learned the efficacy of fasting and rest. Some animals use a partial fast and lots of exercise, while others prefer more rest and fresh grasses. In all cases, the only healing device the animals outwardly employ are food, rest, and activity. Will not these same factors work to correct the many maladies endangering human health? Common sense, empirical evidence, and the personal histories and thousands of people say yes. Let's look at an example of drugless self-healing. The case of Idie Mae Hunsberger. Idie Mae Hunsberger and her husband Arn attended the Hippocrates Health Institute in 1973 because conventional cancer treatments were not helping Idie, who had recently found out that she had malignant breast cancer. A surgeon she visited told her there is no known cure for cancer. We can't claim a cure. The best I can tell you is that you have an 80% chance to live 1 year and a maximum life expectancy of 5 years. Idie Mae chose to undergo a a surgery which appeared to remove all of the cancerous tissue, but the cancer soon spread to other parts of her body. Depressed and confused, Ida May and her husband Arne sought everywhere for help. They met a woman named Wynne Davis, whose son had died of cancer at age 21. Her advice was to go to Boston immediately and visit the Hippocrates Health Institute, where Ida might learn how to heal herself of the cancer. In a matter of days, the Hunsbergers made all the arrangements and flew to Boston. When I first greeted them, they were both frightened and wondered if they were doing the right thing. Within 2 weeks, however, the feared doubt passed, and Ida knew she would win the battle. 2 years later, after sticking to the diet almost entirely, she recovered from her cancer. Her story is told in How I Conquered Cancer Naturally by Ida May Hunsberger and Chris Laufer, Harvest House Publishers. Ida May's case history does not represent adequate scientific proof in itself. However, her experience and that of many others has given us observable evidence that the Hippocrates diet can cleanse and strengthen the body when it is combined with proper rest and exercise. A stronger, cleaner system can better defend itself against the millions of germs, stresses, and potential carcinogens we are exposed to daily. It would be fitting to end this chapter as we began, with the words of Hippocrates: "Nature heals, the physician is only nature's assistant."